Let's start with a short history of medical practice in the US. So, in pre-industrial America, medicine was a trade without today's prestige because no one was required to undergo rigorous course of study, obtain a degree, have residency training, have some clinical practice during your training, take your board exams, or even licensure exams. Anyone who's either trained or untrained could practice as a physician. So basically, anyone who says he's a physician can practically walk into a small town and say he's a practicing physician. Excuse me. For example, there were some professions, or should I say, occupations that were sort of related to what physicians do today, and one of them were barbers. Uh, Barbers practiced what we call bloodletting, also called as leeching, and this is and bloodletting can be done in two ways, and the other one is through leeching. And this is one of the reasons why, if you ever come across a barber shop, you see that sign wherein you have a swirl of red, white, and blue, but mostly it's the red that you should pay attention to, and it stood for the surgical interventions that they were allowed to do. They could even set bones and do tooth extractions, but most of all, bloodletting, because during those times, people believed that your sickness is in your blood. So if you need to get over a certain disease, you can go to a barber. The barber is actually going to slit your vein, usually the one in your the back of your elbow and your forearm, what we usually access today when we draw blood. And then there's going to be a pail or a dish that will be receiving the blood that's dripping out of you. And the barber decides when to stop. Another way of bloodletting, or removing blood from a supposedly sick person, is through leeching, and that's through the use of leeches. And they would put it in strategic places of the body, say, for instance, where inflammation is happening or infection is happening, and they would do bloodletting by using leeches to suck the blood in a particular area of the body. Another occupation was that um practiced medicine at the time were the clergy. The clergy often combined their medical services with their religious duties. And this was quite actually logical because they were usually the only ones in any given community that had the highest educational attainment. They would have gone to a university, they would have studied, some basic, uh, they would have taken courses in basic human anatomy and physiology. Now remember, this was pre-industrial America, and of course the knowledge at the time is very much limited. So pre-industrial America covered the colonial times. So since the establishment of the colonies until about 1870s. At the time, many physicians had a second occupation because the income they make out of practicing physicians were really inadequate. It was, by demand, and they had to have a second occupation to support themselves and their families. And also at this time, the practice of medicine was more a domestic practice, and it wasn't really professional. And the medical procedures were primitive. Um, there was lack of understanding of bacteriology and microbes that could cause infections. So amputations actually do result more often in sepsis and infection, which does more harm than any good. Um, Even as late as the Civil War, surgeons were noted to be doing amputations in soldiers that were injured, cutting off limbs, and using knives and without sterilizing the knives, and sometimes even scraping it in the heel of their boot. The way they stopped the bleeding was, of course, using tar, black tar, and it basically just burns the flesh and therefore stops the bleeding. Just to say, medical education at this time was not grounded in science, and Medical practice was more of a trade, a domestic practice, than a profession. And of course, we need to understand that a profession and a trade are two different things. A profession is something that you normally would have to undergo formal training for, academic training as well as practical training, and get some form of licensure. Whereas a trade is something that you get out of apprenticeships and training, for instance. Also, at this time, the nation had very few hospitals, and most of them existed in the large cities like New York, Philadelphia, and Boston. And also at this time, there were no private or public health insurance. So before 1870, medical training was largely done through individual apprenticeship with a physician who's practicing in a given community rather than getting the training through a university or a formal place of learning, an academic institution. So, how do you do this? Well, you walk up into a physician, a practicing physician in any given town, try to convince him to take you in as an apprentice, and he will then, if he decides to, if he thinks you have the aptitude to do so, he'll take you in and you will be his assistant for as long as he would want until he releases you and says, okay, I'm going to sign off this sort of certificate saying that you're qualified to be a physician. Now, to be fair, some of these practicing physicians came from Europe. And at the time, Europe's practice of medicine was way advanced than it was in the colonies of the United States. So some of them really had formal training in Europe, in Vienna, in Germany, in Italy, and they just emigrated to the colonies, the United States. Well, it wasn't the United States at the time, but the colonies, and then they would take on apprentices because they need assistance anyway. So, as an apprentice, you learn by being an assistant, and eventually, you would hope that the physician that has taken you in to train you would one day say, you have received enough training and you are now competent to practice independently as a physician. Perhaps you move to another town to establish your own practice. So, one problem that physicians recognize by taking on a one on one training, one on one trainee, such as an apprentice, is that they could not really train a large number of students. So basically, out of economic necessity, what these American physicians did, they banded together and they started opening their own medical schools. And how did they do this? So let's say there were four physicians, say in a city, and they said, okay, why don't we band together, establish our own medical school? You're interested in primary care, you're interested in surgery, you're interested in pharmacology, because at the time also there was no formal profession in pharmacology. Doctors themselves made their own medications. So what they would do then is they would perhaps take in two or three apprentices each. So if there were like four of them, if they take on three each, they will now have 12 apprentices. And they also started charging some form of payment or tuition fee. At the same time, they also gained assistants who were themselves their own trainees, the physicians' trainees. One thing came out of this was that this sort of started a formal training because there was some sort of standardization, and there was some division in terms of areas of specialization. So a physician would teach all the 12 apprentices, for instance, about surgery. The other one would teach, the physicians about primary care, and so on and so forth. And at the end, these apprentices, after they have undergone this semi-formal training, they were awarded 2-year degrees. And at the time, the Doctor of Medicine degree was a 2-year degree. The medical institutions during pre-industrial America uh, were the precursors of the current day modern hospitals and medical systems that we have. And they originated from the poorhouses, or the so-called almshouses. These almshouses were existent in almost all medium-sized and big cities, and they were mostly run by local government. Now, they basically accepted, the very sick, the orphan, the elderly, and there was really no professionalization for nursing, for instance. So it affected how these almshouses were being run, and they're mostly staffed by volunteers. A lot of them were actually staffed by uh, people of the cloth, like nuns and priests and brothers, and they took it upon themselves as their ministry. And one notable thing during this time is that if you're rich, you don't go to any of these places because you will get even more sick. And what happened was, because you're rich, you're able to afford to pay the physician to pay you a visit. Now remember, at this time also, medical technology was very much limited, that everything a doctor would need to treat a patient would fit in a satchel. So they could pretty much, say, visit a patient and have everything, with them in a satchel, and probably they would have an assistant, an apprentice to help them uh, do consultations and treat patients. Another feature that we saw in pre-industrial America was the start of outpatient care, and we call this dispensaries, and they served as the equivalent of outpatient clinics of today. And they are staffed by the medical students or the apprentices, and they delivered free outpatient care. In turn, those who delivered services were learning at the same time. And this probably sounds familiar to you, because today we have outpatient clinics that are part of teaching hospitals, and they're mostly staffed by resident physicians in training. And this is where that model came from.